Доброго
Good afternoon, dear colleagues. I'm sorry for a short delay. We had to communicate with the Russian journalists. But we would like to return to our daily briefing on the issues of the progressive reforms in Ukraine. Last week was very active, associated with the adoption of different decisions in the Verkhovna Rada. Part of those decisions, unfortunately, was not passed. And we actually try to concentrate attention to some of those. And today we would like to draw attention to the issues of healthcare and three draft laws, 23098, 2310, and 2311, which were submitted to the Verkhovna Rada by the government. They had to start the practical implementation of reforms in the sphere of healthcare. Within the UMC, we are going to conduct a number of events to explain those draft laws, because they are kind of cornerstones for the implementation of those reforms at the different sites. Those draft laws introduce the idea of automation of medical institutions, automation, and this is a kind of synthetic, absolutely synthetic notion, which means in practice that the healthcare institutions here will change their organizational legal structure or form, which is their legal status of those institutions, and by virtue of those draft laws, the medical institutions will stop to be the budgetary institutions. They will be autonomous public and communal establishments. So each hospital will have to register legally. What does it mean? It means that after this automation, autonomization, we'll see the status of those institutions, who is manager, who eliminates the people, and to see in principle the balance, both financial and economic, of such institutions in their legal relationship. In this way, the hospital will become more transparent from the point of view of economic management. Does it impact some specifically providing the medical treatment from a hospital to an ordinary patient? No, because the implementation of this reform does mean in no way the change of the nature of the relationship between the hospital and the patient. This pertains to other stages of the reform, but if we're talking about the changes, change of the organizational legal form of the hospital, will allow it to more clearly see and more specifically plan the state funding received by the sector of the healthcare, and more easily, let's say, carry out new approaches to providing the medical services and treatment. Definitely, those draft laws encountered not really correct understanding regarding the payable payment or commercialization of medical establishments. Once again, I would like to emphasize the idea was to turn such institutions towards individual legal entities with clear statutes, without changing drastically the mechanism of their funding or their belonging. They will stay within the public or communal structure. We're going to regulate the relationship between the hospital and the patients. Also, we have to emphasize that those three draft laws are extremely critically important in order to start implementing the reform of the sphere of healthcare. May I remind you that during the latest meeting of the National Council Reforms, based on the results of monitoring of the efficiency of implementation of the reforms, the reform in the healthcare sphere was, is such which has the slowest pace of implementation. That's why the adoption of those three draft laws, 2309A, 2310, 2311, will speed up the let's say the implementation reforms in the health care sphere, and we on our part will do our utmost in order for the Parliament as soon as possible to return to their consideration, and so that the reform in the sphere of healthcare has, let's say, correct pace progress, etc. So that's it. Any questions or clarifications? If not, thank you very much. See you tomorrow.